Well, you are looking after, you're caring, and you can get very tired. And obviously if you're tired, and it's not just the sexual, it's the emotional, because there's this, on any relationship, as we all know, there are strains, but on a relationship with an ongoing illness, it can be catastrophic at times.
Doctors can be just as ignorant as laymen when it comes to understanding some of the behavioural problems of Parkinson patients. And again, it's up to us to talk to them and for them to listen and ask us questions, have some kind of dialogue.
When my local hospital could help me no more, they sent me to London, to Middlesex, and they have helped me tremendously. I just wouldn't have been here without them, and I certainly wouldn't be leading the sort of life and having the degree of independence I have at the moment and the quality of living that I have. I certainly wouldn't if it weren't for them. They've used a drug on me which has worked wonders, and for that I'm extremely grateful.
Although our GP has been very, very good to Valerie, he's never stinted at anything. He's never actually sat down and talked to us about it, about problems. He's never said to us, now what are the problems that you're having? Or let's just have a talk. Whenever we visit him for a prescription or a new certificate, he's never actually sat and spoke and took time with us to actually say, well, is everything all right at home? How are you coping with this? You know, how are you coping with this new tablet regime? Or pre-apomorphine, it was the same. Never. Although he would quickly, if we said to him, you know, we need a referral to so-and-so, or he would do it. But he wouldn't stop. He never once has anybody said to us, do you think the needs of a physiotherapist, a speech therapist, an occupational therapist, do you need these services? That's something we have gone out to find ourselves, and I think too late.
I'd like them to remember to ask the patient how he feels and to listen to the patient. I'd like them to be more aware that each patient is ever so different.
A lot of people say to me when we're out, how's Hillary? I say, she's here. Ask her. We mustn't cut them out.
I have been a couple of times, or more than a couple of times this year, ill. And I have tried all the resources from practitioner, district nurses, social services, and there's no one to help. No one. And so that just does worry me, because I feel that they don't always understand the medical side, Parkinson's, and it really gives me nightmares to think who's going to love and care for him. Because I still look on him as though he's my husband years ago. You camouflage all what they look like now, or how they behave. And so he's still my Tom. I'd love to think he was going into a home that is going to be caring and loving for him. They would understand him. And I want, you know, just love, and say that they'd be there and say, oh, Tom, come on. Like when he went in hospital before, they gave him an enema, and they just left him there, and I had to clear it up after him. And they just left him after an enema. I just want the medical profession to understand that they're human, they have got dignity, and just to listen and just wait for them to tell you things. And that's all I want, really, just someone to care for them, to say that they are human.
The needs of carers are seen to be recognition and acknowledgement, information, honesty, reassurance and encouragement, to be valued and listened to, practical and emotional help, access to all appropriate treatment and care, a good night's sleep and time for themselves, understanding and loving respite care, good health and financial help. The needs of patients are seen to be treated as individuals, dignity, respect and independence, access and early referral to all appropriate treatment and care, compassion, understanding, time and patience, the quality of life, honesty, reassurance and encouragement, information, to be involved and listened to, and a cure.
Oh, your back's against the wall. Any second you might fall. In your heart, it's beating fast. It feels that it won't last. No, your back's to the wall. Oh, you fight unfightable pain. And you feel you're going insane. Something inside of you, deep inside of you, even you don't understand. No, your back's to the wall. Back to the wall.
One of the most important things is to treat everybody as an individual. You know, give them credit for the fact that they have a life, they have a mind, and they have a brain, and try and encourage them and support them to do something.
Listen, good friends, they're still around. Yes, they are. They'll pick you up if you fall down. And I know, you know the score. You've been there before. You're back to the wall. Back to the wall. Back to the wall. Back to the